Are you constantly battling with stomach issues, fatigue, or even skin problems? These could be more than just random health issues. They might be warning signs of a condition that's silently wreaking havoc in your body. Leaky gut syndrome. Stay tuned till the end because, apart from unveiling these signs, we're also sharing 4 life-changing tips to stop leaky gut in its tracks. Welcome back to the channel, where we dive deep into everything health and wellness. If you're new here, don't forget to hit that subscribe button and ring the bell to stay updated with our latest videos. Today, we're exploring a critical topic that affects millions but often goes unnoticed: leaky gut syndrome. By understanding the signs and knowing how to combat it, you can take a big step towards better health. So, let's get into it. Before we delve into the signs, let's first understand what leaky gut is. Imagine your intestinal lining as a wall that selectively allows certain substances to pass through while keeping harmful substances out. In leaky gut syndrome, this wall gets compromised, allowing toxins and bacteria to seep through, potentially leading to a myriad of health issues. This condition isn't just about stomach pain or digestion. It can affect your entire body, from your brain function to your immune system. The causes of leaky gut can range from an unhealthy diet, excessive stress, toxin overload, and bacterial imbalances to the misuse of antibiotics. Now that you have an understanding of what leaky gut is, let's spotlight the 10 signs that could suggest you have a leaky gut. 1. Chronic diarrhea, constipation, or bloating. Persistent digestive issues such as diarrhea, constipation, and bloating can be telltale signs of leaky gut. These symptoms occur because an impaired gut barrier allows harmful substances to irritate the digestive tract, leading to an imbalance in gut flora and disrupted bowel movements. This chronic irritation can cause gas buildup and bloating, making the abdomen feel uncomfortably full, even after light meals. 2. Nutritional deficiencies. When the intestinal lining is damaged, it becomes less efficient at absorbing nutrients from the food you eat. This can lead to deficiencies in vital vitamins and minerals, such as vitamin B12, iron, and zinc. These deficiencies can manifest in various ways, including fatigue, hair loss, and brittle nails, and they highlight the body's struggle to extract and utilize essential nutrients effectively. 3. Fatigue. Chronic fatigue in the context of leaky gut is often a result of systemic inflammation and the body's constant immune response to unwanted particles passing through the weakened gut barrier. This ongoing battle not only diverts energy but can also lead to poor sleep quality and a disruption in the normal production of energy-enhancing nutrients, leaving you feeling perpetually tired. 4. Skin issues like acne or eczema. The skin is a reflection of internal health, and an irritated gut can manifest as skin conditions such as acne, eczema, or rosacea. This occurs because toxins from a leaky gut can overwhelm the body's detoxification systems and begin to irritate the skin, often resulting in inflammation and breakouts, which are signs of the body trying to expel these toxins through alternative routes. 5. Food sensitivities. As undigested food particles escape through a leaky gut, the immune system may identify these particles as threats, leading to an inflammatory response every time the food is consumed. Over time, this can develop into sensitivities to foods that previously caused no issues, such as gluten or dairy, as the body starts to associate these foods with a harmful immune response. 6. Autoimmune diseases. A leaky gut can increase the likelihood of developing autoimmune conditions, where the immune system mistakenly attacks healthy body tissue. This is theorized to occur because foreign particles entering the bloodstream can cause the body to become overly defensive, sometimes to the point of not distinguishing between its own cells and invading pathogens, potentially leading to diseases like Hashimoto's thyroiditis or rheumatoid arthritis. 7. Headaches, brain fog, or memory loss. Neurological symptoms such as headaches, brain fog, or memory loss can be directly linked to gut health. The gut-brain axis, a complex communication network linking the gut and brain, means that inflammation in the gut can lead to inflammation in the brain, impairing cognitive functions and leading to symptoms that affect your mental clarity and memory. 8. Excessive cravings for sugar or carbs. When the balance of good and bad bacteria in the gut is disturbed, the overgrowth of yeast or harmful bacteria can occur. These organisms thrive on sugar and can send signals to the brain to increase sugar and carb intake, creating a difficult cycle of cravings and further imbalance in the gut microbiome. 9. Mood issues, like anxiety or depression. The gut is sometimes called the second brain because it produces a large amount of neurotransmitters, like serotonin, which regulate mood. A leaky gut can lead to decreased production and improper function of these neurotransmitters, contributing to mood disorders such as anxiety and depression. 10. Joint pain. Chronic inflammation from leaky gut doesn't only affect the gut itself. It can also lead to systemic inflammation throughout the body, including in the joints. This inflammation can cause joint pain and stiffness, which are often misattributed to more direct causes like injury or overuse, but may actually originate from gut health issues. Now, don't worry if some of these signs sound familiar. There are effective ways to heal your gut and protect your health. Prevention and treatment. 1. Revamp your diet. The first line of defense against leaky gut is a careful examination and modification of your diet. To support the healing of your gut lining, focus on incorporating whole, unprocessed foods that are rich in fiber, such as fruits, vegetables, and legumes. These foods promote the growth of beneficial gut bacteria and can help reduce inflammation. It's also crucial to eliminate or reduce intake of known irritants and inflammatory foods like gluten, dairy, refined sugars, and alcohol. An anti-inflammatory diet rich in omega-3 fatty acids, found in fish like salmon and flax seeds, can also help soothe the gut. Consider an elimination diet to identify and remove food triggers that exacerbate symptoms, helping to stabilize the gut environment and reduce permeability. 2. Supplement wisely. Supplements can play a vital role in healing leaky gut by replenishing deficiencies and supporting gut barrier function. Probiotics are essential as they help restore the natural balance of gut flora, which is crucial for a healthy gut lining. L-glutamine, an amino acid, serves as a primary nutrient for the cells of the intestinal lining and can aid in repairing and regenerating the gut wall. Digestive enzymes can also be beneficial, especially if enzyme insufficiency is contributing to poor digestion and nutrient absorption. It's important to choose high-quality supplements and consult with a healthcare professional to tailor a regimen that meets your specific needs. 3. Manage stress. Chronic stress is a significant contributor to leaky gut, as it can weaken the immune system and exacerbate gut permeability. Managing stress effectively is therefore a crucial part of treatment. Techniques like regular exercise, mindfulness meditation, and adequate sleep can significantly mitigate stress. Exercise not only reduces stress but also helps to increase blood circulation to the gut, which supports the healing process. Mindfulness and meditation can reduce the body's stress response and improve your overall psychological well-being. Ensuring you get enough restorative sleep is also vital, as sleep deprivation can lead to increased inflammation and harm to the gut barrier. 4. Avoid unnecessary medications. Certain medications, such as nonsteroidal anti-inflammatory drugs, NSAIDs, and frequent antibiotics, can damage the gut lining and exacerbate leaky gut symptoms. These medications should be used judiciously and only when absolutely necessary. If you frequently use NSAIDs for pain relief, consider alternative pain management techniques like physical therapy, acupuncture, or other non-drug therapies. For those who need antibiotics, it's important to follow up with a course of probiotics to restore gut flora balance after treatment. Always discuss with your healthcare provider the potential gut-related side effects of any medication and explore possible alternatives. Each of these strategies requires a personalized approach, and it's beneficial to work with healthcare professionals who understand the complexities of gut health to ensure the best outcomes. Remember, this video is for educational and informational purposes only. Always consult with a healthcare professional before making any changes to your diet or health routine. That's a wrap on the signs of leaky gut and how to combat it. If you found this information useful, give us a thumbs up, and don't forget to subscribe for more health insights. Have you experienced any of these symptoms? Share your story in the comments below. We'd love to hear from you. Stay healthy, stay informed, and we'll see you in the next video.